VoCare has developed ways to allow a patient to stay home but have their vital signs monitored and have the ability to see and talk with their doctor via video conferencing. So joining me to talk about VoCare is the company's CEO and president, Steve Peabody, and welcome.
Thanks, Barb.
Let's talk a little bit then about what's new, because you've been in telemedicine and video conferencing. What is new about this product?
This product is built on a mobile platform, so basically what's different from ours versus anyone else's that are out there is we drove the cost out of the product, allowing a higher adoption rate. Mm-hmm. So we combined three different technologies: one cell phone technology, one video data collection, and one video conferencing on a remote platform and on an MVNO, mobile virtual network operator platform. So basically we can subsidize the equipment, subsidize the back-end platform, and allow the cost to be driven out of the platform, so we actually can have the patients afford the technology.
Okay, so do you have a price ballpark already set?
Yeah, so for the cell phone and the phone, it can get up PERS, and the video conferencing tablet, around $500 to the patient.
Okay.
And most of the time that's subsidized through Medicare or Medicaid elderly waivers or Lifeline link up. So the people that can't afford it, actually, the government actually reimburses for the hardware and software.
So who would be your customer here then? Is it the hospitals and the physician groups, the primary care groups, or the patients themselves?
Two. One would be outpatient programs for the hospitals to reduce the readmittance cost, so they're not getting paid for readmittance any longer, so ROI for that. And then also for the primary care physicians, promoting better health and better outcomes for their patients. So they actually benefit for keeping their patients more healthy. The patient actually benefits from keeping out of institutional setting and being tied into the primary care physician.
Now, what all can be monitored then, and what all can physicians do for their patients via this telemedicine conferencing product?
Okay, well they can monitor all the vitals that they normally would. Mm-hmm. And they can do trend data with that. So if it alarms out, the physician or the physician's group can be notified, either by email or BlackBerry or whatever it might be, and either schedule an event or a visit with that patient, either through video conferencing or a face-to-face visit. And they also can do a face-to-face visit now and most likely be reimbursed for that face-to-face visit through teleconferencing, first time.
So now you have a number of institutions locally and around the Midwest that are demonstrating these, doing demos, and then you go on to the pilot phase. So what's the status of VoCare and where you are now with this particular product?
We're able to demonstrate the technology and also the business model. And what we did was try to find three outstanding pilot partners. And so what we did was look for Marshfield Clinic, who is leaders in the telehealth industry, very large, maybe 8,000 employees in the Midwest. And
Wisconsin,
yep. And in the rural settings, so they can adopt this telehealth very easily. Mm-hmm. They can utilize it. An American Health Network here locally, Dr. Ben Park, and Indiana University. So they're going to all three pilot the program, and then we'll have a rollout schedule after that, and we'll start here in the Midwest. Most likely here in central Indiana.
Is there quite a bit of approval left to go with the FDA and other various agencies?
Yeah, we'll have to go through the FDA 510 clearance, FCC, and UL for the product, but pretty straightforward.
Okay, I'm going to ask you a really easy question that's probably complicated to answer, but I was just curious in terms of the patient use. How easy is it for someone who has got a chronic condition or perhaps elderly to be able to operate this?
Yeah, it steps them right through the process. And then we also have a call center. We're using Telemon here locally for our back-end customer service and technical support. So basically, it walks them right through it step by step, so very easy user interface. And then for the folks that would have a hard time maybe with the technology, we can either send a visiting nurse or they can come back into the doctor's office and be walked through the process.
Okay, well, thank you so much and good luck.
Well, thank you, Barb. I appreciate it.